A lot of our companies are dropping health care and making the copay higher. And our people in this area, in the state of Iowa, are having it tougher and tougher. So why aren't the independent insurance companies starting to kick in to help our people?
Because they don't have, there's no market for it. If there was a tax exemption that made your buying of your own health insurance as attractive as your employer supplying it for you, lots of people would buy health insurance. And as more and more people bought health insurance, it would drive down the cost of health insurance. See, it doesn't necessarily have to be you.
No, I have good insurance.
Okay, and I do too.
I just talk to all
But I'll tell you,
people that are losing it.
But I'm going to tell you, if you and I bought private health insurance, we would probably help drive down the price of private health insurance for other people. But we don't have an incentive to buy health insurance. My employer supplies my health insurance. Maybe your employer supplies your health insurance, right? We don't get taxed on that. Your employer can go out and buy a health insurance policy for you and your family, if you happen to be lucky and have an employer who does that. You don't pay any tax on it. The employer gets it as a deduction. You don't pay any tax on it. There's no incentive for anybody who has employer health insurance to go buy health insurance on their own. But if those people who had employer health insurance had a $15,000 exemption from taxes to go buy their own health insurance and had the following incentive: if they could buy it for less than $15,000, they got to keep the money. Then they would go buy it, and health insurance companies would create products at $9,000 and $8,000 and $7,000 and $10,000, because that would lure people to buying it. That's how a market works.
But then does our government step in and say, okay, this is the deduction, now we're going to start this program to where...
Yeah.
So it would be the government
The Congress of the United States has to pass an exemption for all of us of $15,000 in taxes.
Government stepping back.
Okay? And set up a health savings account for the difference in money. So here would be the incentive for me. If I could go find a health insurance program for me and my kids of $9,000, I could save $6,000 a year and put that in a health savings account. And then if I knew I had $6,000 a year in a health savings account, I could go look for a policy that had a deductible of $3,000 or $4,000 a year. That would drive down the cost of the policy. If I did that, and 50 million more people started doing that with me, we would start to drive down the price of health insurance. We would start to create a competitive market in health insurance. That's the way we're going to save health care in this country. We're going to keep it private. We're going to create a gigantic market. If we don't do that, we can't afford it. Right now, the cost of Medicare and Medicaid may be a little off on this, but altogether it's about $760 billion right now. Over the next 10 years, it's going to go to about $1.2 trillion. The cost of our military is less than $500 million. We may be in a position where we're spending 2 to 3 times more on health care, just the government spending, than we do on our military. You can't run a government. You can't run a business like that. You've got to find ways to reduce the cost of health care, and the only way you reduce cost is with a big market.